Welcome, everyone. So glad to have you joining us. Today's webinar is the NMRC Research Board webinar in integrated school-based mentoring. We'll give folks a few minutes to join us, but in the meantime, please share in the chat your name, the organization that you're with, and where you're joining us from today. Welcome, everyone. We'll go ahead and get started. We've got a good group of us here. So we'll go ahead and kick off today's webinar. So glad that you all are joining us. Whether it's afternoon, your morning, you're joining us for your lunch break, wherever you're calling in from. We're so glad that you're here today for today's NMRC webinar, Integrated School-Based Mentoring. My name is Rachel Bennett. I am the research manager at Mentor. I'm joined by my wonderful colleague, Dr. Kelly Stewart at the University of Illinois, Chicago, who'll be helping with today's webinar. A few logistical pieces before we get started today. During the webinar, please use the Q&A feature. You can see that at the bottom of your controls. It says Q&A to post your questions throughout the presentation. Our speakers will address all of your questions at the end of today's talk. Following the webinar, everyone will get a copy of Dr. McQuillan's lovely slide decks, so you don't have to commit everything to memory. Our webinar is being recorded and will be posted to the NMRC website, nationalmentoringresourcecenter.org. So you can be sure to share that with any of your colleagues who are not able to join us today. And I'd love to introduce you all to our speaker today. It's my pleasure to introduce Dr. Sam McQuillan. Dr. McQuillan is the associate professor in the School of Psychology at the University of South Carolina, as well as a member of the NMRC's Research Board. In his work, Dr. McQuillan studies how schools and communities can join forces to promote emotional, behavioral, and academic wellness in young people. And his current work is focused on the development and implementation of training and supervision models for adults in helping roles, folks like mentors or other paraprofessionals supporting young people. And today, Dr. McQuillan will share insights with us on the use of mentors and other caring adults as essential members of student support teams within school settings, who can not only bolster assistance to students, but also optimize service use. He'll also share more about key strategies that mentors can use in these roles to support students' mental health and academic needs. And with that, I'll turn it over to Sam.
Thank you, Rachel. And thanks, folks, for attending the webinar. I'm going to start sharing my slides shortly, but before I share it, I also wanted to introduce a community partner that actually we just met at the National Mentoring Summit in DC, and I think represents a theme of this type of work that we've been doing, is that, I'll go around the country or region and talk about this idea of integrated school mentoring, and inevitably a handful of people in the audience will raise their hand and say, hey, we've been doing that for a long time, or we're already doing that. And I think Carrie Smith, who will have an opportunity to share how this has been working out for him, and we've operated completely independent of each other, but when we started comparing notes, same things that we found, he found. And I also noticed that we have Allie Cloth in the audience who's got a wonderful program of research on needs-based mentoring in schools. But the reason I bring this up is that this is not something that we've created. This is something that people are doing all over the country. I think one of the things that we hope to do today is to share what we've learned. So we've had a project that's been funded for quite some time on how this actually works in the real world, considerations that we need to take, and then also share some of the evidence that we've acquired from randomized trial, but then also share a tool that we've used to help facilitate these type of integrated school-based mentoring partnerships. So Rachel, I'm going to try and share my slides, and then maybe you can give me a thumbs up if they look like they're coming through.
Absolutely.
Okay.
All right, we can see it, Sam.
All righty, very good. Let's see. So a disclaimer that I've been instructed I have to read. The development of these materials is supported by this grant of the Office of Juvenile Justice Delinquency Prevention. The opinions, findings, and conclusions or recommendations expressed in the materials in their presentation are those of the authors and not those of the Department of Justice. So just as a basic introduction, and I don't want to admire the problem, I think we're probably all familiar with the fact that young people today are struggling in unique ways. Normatively, their experience, emotions that they have and challenges are different from prior generations. And a lot of the impetus for this type of mentoring has emerged from the need that's caused by this youth mental health crisis. And then I want to talk a little bit about this idea of integrated school mentoring, what we mean by integrated, how it's different from traditional school-based mentoring. And then I want to provide an example that my research team at the University of South Carolina has been working on, but I think more importantly, I'd love for our discussant, Carey, to comment on some of the essential features that he's found on his own, working independently from us, but tackling some of the same issues. We also have a couple resources that we're going to share. So there's going to be 2 QR codes that we go through, and you can feel free to screenshot, or you can just wait until we send something out at the end. But we also have developed a couple training tools. So we're going to share 2 example just-in-time trainings towards the end of the presentation today that you'll be able to watch on your own. In general, we found that in these webinars, showing videos never works out because the sound is weird, the video is weird. So we just said, you know what, we'll send it to them at the end and they can watch it on their own. But one of them is focused on supporting young people that have anxiety in school, using a brief 3 to 5 minute just-in-time training video. And then the other one is a just-in-time training video on using motivational interviewing and a value activity to help engage young people. So without further ado, I'm going to go ahead and jump into our discussion on the child and adolescent mental health crisis. Again, at risk of, belaboring the issue, there is a child and adolescent mental health crisis. This is not new to the pandemic. This was first announced by the Surgeon General in 2000. Year after year, with very few exceptions, there has been a progressive decline in child and adolescent functioning. There are some folks who would blame this on prevalence inflation. There's some recent research that would suggest that there are slight prevalence inflation, meaning that young people are reporting more impairment than they're actually experiencing. But this is not what's driving the crisis. So the actual crisis is found in almost all of our indicators, ranging from emergency room visits to suicide attempts and completions. There's very strong evidence that there's been a progressive worsening of mental health. And then we all know that the COVID-19 pandemic sort of catapulted this crisis into a crescendo that we're still figuring out what the implications are going to be long term. This is on top of, in 2023, the Surgeon General, the same office that announced the mental health crisis in 2000, 23 years later, said that we're now in an epidemic of loneliness and social isolation, which is particularly relevant to the idea of supportive relationships as intervention that we're going to be talking about today. So again, I'm going to blast through this. Nearly every indicator of mental and emotional distress is increasing for young people. It seems to be a pretty precipitous decline beginning in the early 2000s and progressively worsening. And we see this idea of integrated mentoring not as panacea or cure-all, but as one piece in the puzzle of helping young people develop and thrive in modern 21st century world. So I think there's a compelling case that this idea of integrated school mentoring can be something that can really help young people. So why are we talking about mentoring in the context of this? Is when we have a loneliness epidemic, child and adolescent mental health epidemic that are co-occurring, lots of pundits and people are asking the question is what causes the child and adolescent mental health crisis, what's causing the loneliness and things about that. But rather than kind of going into cause and effect, I just like to highlight that relationships are super important. If you look at biological anthropologists, or sometimes they call themselves physical anthropologists, they would describe the development of these unions that we have with other people who are not related to us as species normal environment. It's part of our species normative developmental sequence where we have these relationships with other people. Our brains, if you look at the same type of research, it would show that our brains are hardwired for these relationships. And when we don't have these relationships, our physical and mental health suffer. In fact, a lot of insurance companies start tracking loneliness because it's a really great predictor of lifetime mortality, exceeding that of like smoking a pack of cigarettes or obesity and other things. We also know that when children are isolated, it has a pretty strong and poor prognostic prediction for adulthood that children need these type of relationships. And we posit that safe, stable, nurturing relationships that are provided by mentoring may be one way to satisfy some of these basic human needs. So why mentoring again? One of the things that we know, it shows that if you interact with people in person, common sense, right? We had to study it, but you feel less lonely. So if you're interacting with people regularly, especially in person, it seems to reduce our sense of loneliness that we have. So my colleagues, Tim Cavell, Renee Spencer, and I in 2021 wrote a paper that's titled Back to the Future, Mentoring as a Means and an End in Promoting Child and Adolescent Mental Health. And we built the case that mentoring serves two functions. One, as an end in and of itself, is that when we match a young person with a caring adult who can provide a safe, stable, nurturing relationship, that child's going to be better off than if they don't have those relationships. So as an end, the goal of the relationship is sufficient. And if this is our primary goal, then our program efforts should be to recruit, support, and train long-term mentors that can provide that safety, stability, and nurturance. Importantly, though, and especially related to this idea of mental health, is that mentoring can also serve as a means in providing prevention and intervention-focused activities. And what I mean by that is that rather than the relationship being the end goal, the relationship, in addition to becoming a destination, also becomes a vehicle for providing prevention and intervention-focused activities. Things like academic support, emotional support, teaching coping skills, these other things that we know through research evidence can support young people's functioning. And if we think of mentoring as a means, mentoring relationships as a means in addition to an end, our program efforts are primarily situated around training mentors and skills in evidence-based practices and interventions. The classic example that I like to give is the famous British sorceress or wizard, I'm not sure which one, Mary Poppins, who sings the song, "A spoonful of sugar helps the medicine go down." In our analogy, the spoonful of sugar is this relationship that kids are hardwired to crave and to want. And the medicine are these prevention-focused activities that are health-giving, but often less preferred. What I mean by less preferred, I have a middle school son, and if you were to put him in front of YouTube and say, "Have at it," he is not going to be searching social emotional learning skills. He's probably going to be looking at Zelda Tears of the Kingdom or something like that. But he had a mentor at his local school, a guy named Abraham, who would meet with him, and Walker would, kind of go along with whatever they wanted to because he admired Abraham. They had fun together and they would read together and do all kinds of useful activities. So this analogy is highlighting that these relationships allow us, you know, an entry point into providing these less preferred but really meaningful interactions. So again, we're talking about mentoring, which we've just kind of hit, but then why are we talking about schools? And I know that we're all kind of here because we might have some interest in schools or mentoring as well. But why are we talking about integrated school mentoring, and how is this different from school-based mentoring? Well, what we've increasingly found, and we've been doing studies in schools for a long time, but it wasn't really until like 2015 we started thinking about this idea of, what's not working with these type of partnerships? What can we do a little bit different? What we know is that schools and youth mentoring programs are serving the same youth, especially if they're in the same geographic region. But there are oftentimes significant barriers to communication between the mentoring programs or the mentors and the school staff. And what we know is that these two separate entities, mentoring programs and schools, have unique information, they have a unique relationship with the child, and they also have goals that are sometimes common, but they're being handled in different ways. So the idea of integrated mentoring that we're going to get to a little bit more in depth in just a moment is this idea of systematically integrating community mentoring programs into school systems such that there's true teaming and partnership, there's database decision making, there's ongoing support for both the school and the mentoring program. And one of the most common things when we get into this is a lot of times folks will raise their hand and say, but how do you do this stuff? This seems like it's ivory tower or pie in the sky. That's why I brought Kerry along to tell us that it actually can be done, and he's doing it. And he's doing it. He's out. That's his job. He's out in the schools 5 days a week. So I'll continue on. So 3 really compelling reasons that we've thought that, especially in this idea of addressing some child and adolescent mental health concerns, that schools are ideal places for this type of mentoring is one, in schools across the country, the kind of industry standard approach to meeting social, emotional, academic, and behavioral needs are something called multi-tiered systems of support. These might also be called student support teams or database decision-making teams, but they share some unique pieces that I'm going to discuss later. And this MTSS, the idea of MTSS serves as the framework or background for integrated mentoring. The other thing is that schools are a really unique context. For one, schools are super safe, despite what, sometimes the media and others would let you learn. Kids are probably safest in schools. And if we're, matching, potential strangers with young people, school seems like a really a safe place to have really solid supervision and oversight of those type of things. The other unique feature of schools is you have all these people who have degrees in helping professions. You have teachers who know how to teach students and engage students. You get, social workers and counselors and school psychologists and principals and a wealth of experience on helping that are right at, within arm's reach of the mentor when they're at school. And then finally, and most importantly, our schools in many ways are a great equalizer, where schools are where the kids are. You got to go to school, and that's where the kids are. So we have access to young people there as well. So I wanted to talk a little bit about multi-tiered systems of support for those who might not be familiar. Again, MTSS stands for multi-tiered systems of support, and these systems go by different names. Your school district probably has its own name for what they are called, but they're characterized by 3 core components. And to the extent that you don't have these 3 core components, the schools that you're working with probably don't have a functioning MTSS system. So the first of these is universal screening. So universal, as the name implies, is that all young people are screened. In a well-functioning MTSS system, you're seeing screening across the SEBA outcomes, social, emotional, behavioral, and academic outcomes. Ideally, you're seeing screening 3 times a year, but 2 times a year, even 1 time a year can be sufficient, especially if it's well-timed. And what we know about this screening is if you're not screening, you're grossly underestimating the type of social, emotional, and behavioral needs that young people have. And not only are you underestimating, you're also misidentifying the type of supports that young people need in these areas, because some of the new screening tools have great intervention recommendation systems. Which brings us to our second core component of MTSS, is that there are tiered levels of support. So ranging from kind of universal prevention and promotion of social, emotional, behavioral, and academic outcomes to tiered supports that go from kind of that universal to indicated to high needs or targeted support. And then finally, there's progress monitoring, where we're actually assessing, is what we're doing working or not? Are children responding to the approaches that we're using, that we're providing them, using data to adjust what we're doing? And these 3 components of MTSS serve as the backbone for this idea of integrated mentoring. And Carrie later is going to be talking about the importance of data in these type of systems. So within the context of multi-tiered systems of support, and Rachel asked me before this webinar started, she said, if you had to identify one big take home, like what's the one thing that you've learned through this? And I said that the number one thing is how absolutely essential teaming is, of having teams where both the mentoring program, or if not even the mentors, but the mentoring program and the school staff are together regularly in the same room to discuss their shared goals and vision for the partnership. In general, interdisciplinary teams historically have included, folks like principals or assistant principals, administration, general education teachers, special education teachers, content specialists, student support personnel, and other MTSS coordinators. And one of the ideas of integrated mentoring is also having a seat at the table for the mentoring program. So here's if you're a school psychologist or have a background in MTSS, this is the infamous triangle. We actually want to revise this. We've moved away from the colors of green, yellow, and red to less provocative colors. But the idea here is we're not labeling students here as tier 1 or tier 2 students. The goal here is saying, what are the services right now that this student could benefit from or needs to appropriately access their educational setting? And these services that we're able to provide range from tier 1, which is everyone, to tier 3. In general, when we're talking about tier 1 services, we're talking about all services, all students. So all students have access to the services. These could be school-wide assemblies, class-wide curriculums, social emotional learning initiatives, or school climate type things. Just to give you an example, one of the things we're talking about in integrated school mentoring at this universal prevention and promotion is we talk about destigmatizing mentoring, so that mentoring is not something that happens only to students with the greatest need or only to students who have the greatest adversity, but everyone has mentors and everyone can benefit from mentoring. So having teachers talk about who their mentors are, of having administrators talk about who their mentors are, of providing mentoring services to other folks other than those, because there is a legitimate risk with this type of integrated school mentoring, of mentoring becoming some type of othering activity, that youth who receive mentors are different in some way, which this idea of universal destigmatization is talking about mentors as a normal part of our existence. Tier 2 are typically done in small groups or check-in, check-out type programs. In fact, a lot of times school-based mentoring is situated at this tier 2 or tier 2.5, as some people call it, which in general, the historical data would suggest that maybe 5 to 15% of students have access to these. What we're seeing, though, in kind of the peri-pandemic areas, that these bottom numbers are way higher than what was originally thought of in the late 2010s. So you're looking at, perhaps 30% of students that could benefit from these type of tier 2 services. And then similarly, these tier 3 intensive intervention services, these might be students who have eligibility for special education services, or it could be mental health services that are provided from outside organizations but delivered in the school, or traditional kind of school mental health services. So what do we know about MTSS? If this is your first time hearing about MTSS, I'm going to summarize 30 years of research as quickly as I can. But MTSS works. It's an effective approach to identifying students that have needs and responding to those needs. There's lots of research evidence on this. We know that without these type of universal screening prevention systems, we're much more likely to let students fall through the cracks. We're much less likely to provide them evidence-based interventions. And we're much more likely to miss students who have internalizing symptoms. So a lot of times schools will only notice the kids that are acting out while we've got a bunch of students that might be silently suffering. We also know that, the MTSS, the multi-tiered system of support approach, is an alternative to kind of the traditional, wait to fail approach, or when we only respond when students are in crisis, but it's more proactive and preventative. And it's focused on providing support to all students, not just those who have special education eligibility criteria. The idea of MTSS has benefited tremendously from a framework that's called the Interconnected Systems Framework. A lot of this work has been done by Dr. Mark Wiest, who's also here at the University of South Carolina with me. But the idea of interconnected systems framework is the same idea as integrated mentoring, is that we are teaming together with all the supports that are in the community and the school with shared goals around student outcomes. And when we team together in an interconnected way, we have greater access to services, the quality of our prevention and intervention services are stronger, and we're much more likely to have shared and common goals. There's been a number of randomized controlled trials of these type of approaches. We know that we can identify students better for receiving tier 2 and tier 3 services. It reduces student disciplinary infractions and also improves school safety, which are pretty cool outcomes. And this idea of integrated mentoring is simply an extension of this idea of the interconnected systems framework. One of the key features of the interconnected systems framework, or key data points that makes this such a compelling case, is that young people are 20 times more likely to engage in school-based emotional behavioral supports relative to community-based clinics. So if you want to engage young people in these type of activities and experiences, schools have become the de facto provider for these for data-based reasons. But we encounter a bunch of challenges when we try and do this type of integrated work, when we're trying to integrate community-based mentoring programs into the educational system. What we have noticed, my team, and then Carrie can comment on this a little bit later too, is, and I just got off the phone with somebody yesterday who's running a one-on-one school-based mentoring program, and they basically, without me telling them what we're talking about today, they describe this as oftentimes we operate in silos, where the mentoring program goes to the school, meets with the young person and leaves the school, but maybe they talk to the person who's working the front desk. But there's very little data sharing, there's very little collaboration around these things. And we call this type of mentoring as a problem, co-located mentoring. The mentoring program is co-located at the school with these providers, but they're not integrated in any kind of meaningful way. And what this happens is because the mentors do this, they're often not aware of those type of needs that their child has. A lot of times the school has data on particular needs of the children that the mentor may be totally oblivious to. I've experienced this as a mentor where I've been surprised by data points where I could have helped a young person if I had known some important information. And just to quote Renee Spencer, who wrote that article I mentioned earlier with us, she had commented on this idea of, intervention focused mentoring, of if you identify that your mentee has a need and you have the skills and capacity to help them with that need, you're obviously going to address that. Like, are you really in a relationship? If you're not, if it's an appropriate thing to do, if you have the skills and capacity to do it, that's going to be something that naturally occurs in a helping relationship. But oftentimes, because of lack of information, data, and so on, we miss those opportunities. But on the other side of this, a lot of times mentors know a lot more about the kids that they're working with than the school teams do. They might know what's going on in the neighborhood, or what's happening with the family, or what's happening, in the context of the young people's lives that the schools are totally oblivious to. So there's these silos of communication really prevent the type of effective teaming that we know works. So the solution is this idea of integrated school mentoring, where there's direct communication and teaming between the school and the educational system. There's use of school-based data to drive decisions around mentor training and mentor support, but also around how we communicate to young people around the structure of the mentoring meetings. There's supervision that's accessible to the mentor from school professionals like counselors, teachers, or psychologists. And we're not talking about professional clinical supervision, but this could be as simple as a meeting with a teacher to say, hey, I would love to help support so-and-so in their English and language arts class. What would be the best use of my time for this? But then also the school teams can look at their universal data and say, oh yeah, so-and-so has a mentor, and this has emerged as a particular need. Maybe we can meet with that mentor and provide them some guidance. So the defining features of integrated mentoring, and as I mentioned before, we are going to share a fidelity inventory that is currently a work in progress, but we'd love your feedback on it. But the tiered fidelity inventory is an opportunity for you to basically go through a checklist and say, how well are we integrated right now with our community mentoring partners? Some core features, I'm not going to go through all of them because you'll get to go through the big checklist, is data sharing agreements and MOUs are absolutely essential. If there is data being shared between a local education agency and an outside community partner, or even to a mentor in any format, so we're not talking about test records, but just saying so-and-so could benefit from additional instruction in this, you need to have data sharing agreements and MOUs that comply with federal law, in particular FERPA. You also need to have regular school team meetings. So these might be called MTSS meetings or database decision-making meetings or student support meetings, but you need to have those teams. And those teams in integrated mentoring need to include representation from the mentoring program, if not some of the actual mentors. So depending on the type of program, in Carrie's program, they have the actual mentors who are mentoring many kids individually, but in the schools, they have access to this data. But then also these core features of MTSS that we're using universal screening to guide training, but also perhaps matching. And that we're progress monitoring student functioning. So we're saying, is this approach to mentoring or our additional supports that we're providing in the school actually producing the change that we would like to see? And then finally, are mentors using practices that we have good reason to believe are going to move the needle on the outcomes or needs that the young people have? Are these practices evidence-based or research-based as we move forward? This idea of evidence-based interventions brings us to this other construct that I'd like to talk about briefly, which is this notion of task shifting. So task shifting or task sharing, as it's been called. Task shifting and sharing originated actually during the HIV/AIDS epidemic in many of the African countries where the demand for antiretroviral treatments exceeded the supply, and there needed to be a strategic re-regulation of medical providers so people with fewer credentials or less training could help support some of these efforts. In the current child adolescent mental health crisis, this idea of task sharing or the redistribution of sharing of services from licensed or credentialed mental health providers being moved or shared with people who have less credentials or training, like mentors, has become increasingly common. And there's pretty good empirical support that when done well, this type of task sharing or shifting can be a really effective way of of helping support young people. We have published several articles on this, including how to combine multi-tiered systems of support and community-based mentoring programs, of how to integrate services like motivational interviewing to mentors in schools. I'll talk about this in a little bit, in addition to how to structure our training as well. But one of the key challenges that every mentoring program faces, and we found particularly challenging in this idea of integrated school mentoring, is how do we train and support mentors in a way that's responsive to young people's needs, but also drives competency in the mentor to actually address those needs. And one of the first psychological experiments that was ever conducted, a guy named Hermann Ebbinghaus, at kind of the dawn of psychological science, his groundbreaking study found that people forget stuff. And it's common sense, but we know that this is true in terms of how we train mentors to work with young people. But one of the things that we also know is that when you review information that's previously learned, you can curtail what they call this forgetting curve. So we typically forget stuff at an exponential rate, but when it's reviewed, we can get right back up to competency pretty regularly. So this idea of task shifting, we're not working with professionals who go through 6 or 8 years of education to become, embodied professionals of this. We're working with people who don't have these skills, and we're trying to increase their competency. And it can be challenging, especially if these are skills like motivational interviewing. That's, it's an approach to counseling that's not innate. Most of us don't have these skills. It's not really easy to learn, and it's certainly not retained indefinitely. So these type of on-demand responsive training experiences seem to be a really compelling way to drive competency. And that brings us to some of the resources that we'd like to share with you today towards the end of this idea of just-in-time training. And just-in-time training is on-demand training that's designed to drive competence in specific skills when it's needed and only when it's needed. And it's been described as an efficient form of on-demand training designed to improve performance on specific tasks. An example of a just-in-time training is a 3 to 5 minute video designed to teach a mentor how to talk to a young person about school-related anxiety. We'll share actually that video with you towards the end of this training. And we're also going to share another, I'm not going to play it right now, but we'll share another video example of how to use motivational interviewing with mentors. We've studied this stuff pretty extensively for the past 10 or so years. And we've learned a lot around, how to structure these type of trainings, what skills should we task shift, what shouldn't we? So if you're interested in the literature, feel free to reach out and we can share that with you. So how does this idea of task shifting work within the context of integrated school mentoring? So it's basically sharing tasks or shifting tasks from school-based mental health professionals or educational professionals to mentors. So these school-based health professionals are accessible to mentors for supervision and guidance that can further expand their expertise and reach, but they can also provide some type of on-demand support or problem-solving if strategies aren't working. And in this way, we see mentors as this really interesting approach to expanding the footprint of school-based social emotional behavioral services by adding personnel to the school, but also having a really unique role. Carrie and I were actually just talking before the webinar that especially in high schools, mentors they serve a extremely unique role in schools where they're not required to be disciplinarians. They're not required to kind of shepherd the herd of students, so to speak, but they can really just be there and be non-judgmental, affirming, and for the students, which is unlike any other professional in the school. And when we embed mentors into systems like MTSS, we give them the support and tools necessary to strengthen the school's service delivery model. This is highlighting one of the, I think, if I were to summarize, all that I've learned from training mentors and mentoring outcomes and things for the past 10 years, is the critical importance of ongoing training and supervision. This is a study that Mike Lyons and I did in 2021, and I imagine that folks aren't going to be able to read this, but we basically used a machine learning model to figure out what's the single best predictor across a very large national survey of mentoring programs. What's the best predictor of premature match closure? And we looked at things like whether or not the youth were incarcerated, demographic backgrounds, if the mentees had disabilities, all these things. And the single best predictor of premature match closure was whether or not that mentor is receiving ongoing training and support in how to work with young people. So ongoing proactive training seems to be an essential component of this idea of integrated mentoring. So I just like to provide a brief overview of what we're doing in South Carolina on some of this. So we have a large project funded by the Duke Endowment to pilot this in geographically distinct areas of the state, working with 3 or 4 separate school districts to get this done. Just to give you a localized one with Mentor Upstate, which is in Greenville, South Carolina. So we have an organization called Mentor Upstate, then also the Greenville Mentoring Collaborative. And then Greenville School District is the largest school district in South Carolina. I think it has something like 70,000 students or things like that. So we're partnered with 6 middle schools and the feeders of those schools. I think our schools have actually shifted. This slide might be a little bit dated, but we have all of the schools that we're partnered with are members of this MTSS infrastructure and framework called On Track Greenville, where they have long-term data tracking and sharing between buildings. So the feeder schools that feed into the middle schools or have that data on students even before they arrive. But then also, and perhaps more importantly, we've developed strategic partnerships between community-based mentoring organizations and school buildings. Some of these organizations are like, Big Brothers Big Sisters. Others are kind of mom and pop shop mentoring programs, or faith-based communities that are funneling mentors, or universities that are giving mentors. There's not a single stream of mentors that are coming into schools. So this is, before I go on, this is an example of us trying this out, and we are actually piloting this. So we've been doing it for about a year now. We've got another year left in our pilot of how does this work? What are some barriers and pitfalls? And we've learned a lot from these type of partnerships. And I think Carrie and I, when we talk shop around this, he's learned a lot of the same things that we're learning through these. He might have just been there a little bit before us in it. But we've actually tested this in a small scale efficacy trial. So this is a study that was published, I believe, in 2021 with Heather McDaniel, who's also at the University of South Carolina with me, where we basically said, I wonder if we have this type of evidence-based, school-based mentoring where young people are supervised and they have access to just-in-time trainings and school-based support from counselors. I wonder what we can actually see in terms of outcomes. So we recruited students who had the top 10% of misconduct in middle schools. We randomly assigned them to school MTSS as usual, or this idea of an instrumental school-based mentor that went through an evidence-based curriculum with them. And we had universal screening, so we used in this study the BESS, which is a behavioral emotional screening system that I think is produced by Pearson. It's proprietary, but there are very similar universal screening systems. This middle school had kind of prototypical tiered support systems, including like check-in, check-out, PBIS, as well as a pretty robust special education system. And then we also had access to tools that included behavioral emotional support screening, which was our progress monitoring tool as well. So this was right under 70 students that we randomly assigned. We looked at their universal screening for social, emotional, behavioral, their grades, their misconduct, and this was just over a full semester of mentoring. So in this program, the mentors were integrated, so they were supervised by school psychologist trainees in partnership with the local school counselor and a social worker. Data and incidence reports were shared from the school to the mentoring program staff, so we had access to know which students we were serving. And mentors, for each time that they worked with the young person, they received just-in-time training right before meeting with the young people, and they also received supervision on campus. And in this small pilot project, which we're hoping to reproduce at bigger scale soon. And we found statistically significant improvements in math, behavior infractions, school problems, and the emotional symptoms index from the BEST system. And surprisingly, despite it being pretty high need young people in this study, 97% of matches completed, and mentors felt that the curriculum was acceptable and feasible. They didn't feel like it was too much of a problem to actually go through. So before I jump into kind of benefits and some considerations for success, I'm going to stop sharing my screen and reintroduce Kerry for a moment so that he can have an opportunity just to share. As I mentioned before, Kerry Smith works for United Mentoring Program in Lansing, Michigan, and they have mentors at the schools, and they're doing a lot of this stuff. And I've asked Kerry in particular to kind of highlight the program, reintroduce himself, but then also talk about the critical importance of having data to make decisions, but then also how challenging that can be in terms of making those partnerships. So without further ado, Kerry, I'm going to hand it over to you.
All righty. Thank you, Sam. Appreciate the intro. Good afternoon, everyone. Again, my name is Kerry Smith. I'm the Executive Director of the United Mentoring Program. We are located in Lansing, Michigan. For those who are not familiar with the area, Lansing is the capital of Michigan, not Detroit. So that's just a little for your knowledge there. We are a nonprofit 501c organization. The program itself was founded by my best friend, Tracy Edmond. He, just to give you a little background, and I'll get into the information that Sam has assigned me, he very hesitantly took a part-time position at another organization to be a mentor specialist. And during that time there, he and I would talk often about how things were going and how he think things would be better. And two things really stuck out. The organization that he worked with, from a grant perspective, they could only work with children who had been diagnosed with a disability. And there's nothing wrong with that at all, don't get me wrong, but it just left a lot of kids out who weren't specifically diagnosed, if you will. So we were always concerned about those kids. And then the biggest issue, and probably a lot of you feel this pain too, was how do you recruit mentors, good mentors, and how do you retain them over a long period of time? And that's very difficult. And I remember being at the summit, the Mentor Summit, a couple of years ago, and I was at a table talking with some people, and I remember a gentleman, he asked me, he said, "Man, what are you doing to recruit mentors, and then what are you doing to retain them?" And I said to him, we actually do group mentoring. So we do some individual mentoring, but we do group mentoring because it's just easier. It's hard. If you give me 30 kids, it's hard to get 30 mentors. It's not going to happen. And if you have a program and you're able to turn those numbers around, God bless you, and keep doing the work. But it's hard to do. And so our concept of group mentoring said, well, hey, you know what? What if we had 3 or 4 mentors together, and then we still had 30 kids or whatever that number is, and still be able to mentor them as a group. And then the organization itself, our program, will serve as a mentor until we're able to fill and make those one-on-one matches with particular kids. So that's just kind of how we got started. And then he called me one day and said, "Hey, man, let's start our own mentoring program." And that was kind of the birth of the United Mentoring Program. So there's more to it, but just for time's sake, I just wanted to give you a little background of how we got started. As Sam said, we are a in-school mentoring program, which now I'm after our few conversations is very closely knitted to what he is calling integrated mentoring. We're different from school-based mentoring, which I just got a really clear definition on that this past couple months ago at the Mentoring Summit, when I spoke with a young lady from Nebraska. And she said, I asked her, she said, "I'm here, I do in-school mentoring." "Okay, school-based mentoring, I'm sorry. Well, what is that?" And she explained to me, that she and some of her cohorts would go up to the school and sit with a kid for an hour or whatever the case may be. And I was like, oh, now I get what school-based mentoring is. It's more along the lines of any mentoring you're doing at the school, whether it's an hour, whether it's a day, whatever the case may be. We're a little different. We do in-school mentoring. So we're actually in the school 5 days a week at multiple schools. We have a male and female mentor at each school. This kind of helps us kind of cover the demographics of that particular school, helps us deal with some tricky situations here and there, but it works fairly well for us. So the benefits of in-school mentoring, let me kind of cover that. And I'm going to try to be as brief as I can because I want to be able to leave some time for you guys to ask some questions. The biggest thing it does, it allows us to immerse ourselves in their culture. It lets us just see life at school through their eyes day in and day out. It allows us to witness the peer pressure that some of these schools, some of these students are facing, and it's real. I mean, you can cut it with a knife, and you get to feel the anxiety that some of these kids have on a daily basis. And believe it or not, it's very similar to some of the things that we feel as adults on our jobs or in some of the circles that we kind of walk in. It's the same thing, believe it or not. We in school. So what do we do in school? We're assigned students from the staff, from counselors that they may deem at risk. At risk could mean academically. It could mean behavior. It could mean maybe attendance. Some of those big three that really affects how kids progress in school. And so we are assigned those kids. We actually have our own classroom in the school. It's the UMP room at J.W. Sexton High School. We're in room 217. Everybody knows where we're at. The beautiful thing about it, not only do we mentor the kids that they've given us, we're also available to every kid and student. We have tons of kids that just come by our classroom just to hang out and grab a snack. And then we end up in conversations about their grades and attendance. And so it's an assigned group, but it's the entire school that has us at their beck and call, if you will. We do group sessions. Our program is built on 4 pillars, which is life skills, career development, academics, and community service. So in our curriculum that we run throughout the year, we meet as a group. We always pull from one of those particular areas. Our kids they're excused from an hour of class to come to our class for their mentor session. We rotate that hour every week. So for example, this week they came second hour. Next week is third hour, fourth hour, et cetera, et cetera. So that way kids aren't missing the same class every week. But they are responsible for anything that they've missed in that class. Teachers will give them that time to make up anything if they need to. The biggest benefit from mentoring in the school is just the access to the kids. And I think that was on one of Sam's slides. That is crucial. We have access to kids. They have access to us. As many of you know, a lot of what we've discovered, which we know firsthand now, a lot of what our kids are struggling with comes from home. We are dealing with more broken homes in this day than we've ever had. And the fact that you have that, kids are bringing that baggage to school, and it's affecting them academically. It's affecting their attendance. It's affecting their behavior. And we're able to kind of hone in on those things. We're like parents in the school, if you will. They're calling us pops and unc and auntie. And it sounds funny, but there's something in that. There's something in that in itself that they're calling us those particular names because they are trusting in us. And it takes a while, takes a minute to get there. We go into some schools and kids are rolling their eyes at us when we first get there, like, who in the world are you guys and what do you want? And to speak to Sam's point, no, we don't have the authority to punish or do anything like that. So we really have to build our relationship from ground up. We don't have any we don't have any circumstances, we don't have anything that we can do to inflict any punishment on them at all. We can't suspend them. We can't send them to the office. We can't do any of those things. So our relationship is really pure. We build it from the ground up. And that is what really helps us to be effective in the schools. Again, we're in 4 schools in the Lansing School District, 2 high schools, 2 middle schools. Those are different based upon each school is different. Each school has its own culture that you got to kind of go in and fill it out. Now, explaining to Sam earlier, we can go into a middle school and encounter a 7th grader who may be acting up a little bit, and we can say, "Hey, man, sit down. Just sit down, so we can talk through this." You can't do that at high school. It's not going to fly with some of those kids. So you have to be a little more savvy there in the way that you approach and talk to kids. Because if you don't have a high schooler, they already think they know everything anyway. So you gotta approach them a little differently. But those are the areas that we're in. In the fall, we'll be expanding to 3 more middle schools, which we are starting to find that's where we really need to be. The high schools are great; will still remain there, but the middle schools is where you still start to see a shift and change in a lot of kids, and you can really see how their home environment is really affecting how they're behaving in school. This is where we also get a grasp on the gangs, the gang violence. And we know all the gangs, we know who's affiliated with who. And these gangs, they go after our young people. They go after them all the time. And so that's what we're really trying to hit up on and make sure that we're covering all of our bases. Now, second thing I want to talk about real quickly is just the school district itself. Where we're at, our graduation rate in the Lansing School District in the last 3 years has went from 69% to 88%. And that is simply because we're in there not only just dealing with behaviors, we're drilling kids academically, making sure they're prepared and ready to graduate on time. The attendance rate has risen. And then from a city perspective, and these are numbers directly from the chief of police, ever since UMP has been involved with the school district and also with the county courts and things of that nature, crime in our city with youth has gone down 17.5%. And that's remarkable. And a lot of that is because we're preventing a lot of things in school before they spill out. And being able to have an eye on that and being able to touch that information and understanding that our kids, that's a reality for a lot of them. And being in the school, being that pops and that auntie and that uncle really helps us to develop those relationships and kind of ward off some of those particular things. But I'm gonna stop right there. I've seen some questions come across the screen, so I'll let you guys kind of fire off, and maybe I can fill back in maybe something you've heard I can fill back in and answer for you guys.
Yeah, thank you, Kerry. Always good I feel like I learn something every time I hear you talk about this stuff. So appreciate your perspective. And I know I did see that we have a bunch of questions. I'm going to land the plane here on the presentation because we actually are very excited. And we're actually hoping we invited Kerry to help us write a book chapter on this stuff this summer, just from his experience. But we're actually going to be producing a bunch of resources for schools, so you can imagine school districts, but then also mentoring programs. And I wanted to give you a preview because my research assistant, Bailey Dow, is going to send out a link in the chat. And we would love to collect your email and to get feedback on the presentation and ideas that we talked about today. But more importantly, we'd love to keep you posted because we're going to be producing some content, including new just-in-time training videos and fidelity tools and so on. So some of the things we're going to be creating are, we're going to have a public domain guide that will be freely accessible to everyone, including tools such as video trainings and practice models. So for example, how do you work with young people who are struggling with attendance or misconduct or those things. But then we're also going to be developing a fee-for-service certificate program that leverages all these public domain open source tools to have more integrated coaching and instruction on how to make it happen in your program or your building. So that's something that we're looking for mid to late 2026 should launch. But this would be a great opportunity is if you have a partnership between a program and a school, is you run a couple people through the partnership. So we're all talking the same language. You all have the certificate. You have this, you know what the same tools are that we're using. We are continuing to build research practice partnerships, including those with folks like Carrie and others. So if you're interested in partnering, part of that form that we send out, we'll do it. And we'll have a supplement that's similar to the elements of effective practice, but that's really focused on integrated mentoring. So as our initial pass at resources, we've developed a tiered fidelity inventory for integrated school mentoring, which you can get this QR code to take a look at it. This is a work in progress. In fact, the current version that's up right now, we've already made some revisions, but we'd love your feedback on this. But this is something that we use for schools and mentoring programs to basically sit down and look under the rug and say, you know, where are our strengths and where could we grow to become more integrated. So I'm going to leave us off with the opportunity for discussion and questions that I think Rachel is going to leave. But I'm also going to ask Bailey to go ahead and share 2 example just-in-time training videos and then the survey that we are asking attendees to fill out so that we can learn more about you and what you're doing, but then also have the opportunity to connect. But just would like to say thanks to everyone for attending. I feel like we had a good crowd today and good staying power. We didn't lose too many people over the hour, so appreciate everyone hanging around. And with that, I'm going to pass it over to Rachel and or Kelly.
Thank you, Sam and Carrie. Yes, we've got a lot of great questions for you. So we'll just kind of go in order of when we received them. So our first question is from Shane. What data do we have that shows the comparative impact of school programs and services being delivered through a mentoring approach versus having an integrated mentoring program as a separate service component delivered from within the schools in partnerships?
Great. I'm not 100% sure I understand the question, but I believe that Shane is getting at the idea of comparative effectiveness of what evidence do we have to believe that integrated mentoring would outperform maybe mentoring as usual or instrumental mentoring. So I without trying to summarize the cumulative body of evidence we have right now, here's kind of, I'm thinking through trials that I've done. One thing is I have done trials before where if mentors are not using evidence-based practices, there's actually a real risk for them to do more harm than good. So in one of the first trials I did back in 2009 or something like that, we found that when mentors are not using evidence-based practices and are doing things that are actually not indicated by the research evidence, they can actually disrupt a kid's school day. We've similarly done randomized controlled trials where as we integrate evidence-based practices that are aligned with school outcomes, we actually see those outcomes improve and we don't see any risk at a normative level in the randomized trial of harming young people. In terms of the integrated aspect, that's actually something we're preparing to study right now. And I think perhaps the most compelling evidence comes from that 2021 study that was basically school as usual versus integrated mentoring. But we're preparing right now a trial that we're going to be looking at comparing a form of integrated mentoring with a similar evidence-based approach. So it would be a comparative effectiveness trial, but it would be one where we don't put students at risk for bad mentoring. It'd be comparing 2 versions of great mentoring, but one that would be erring more on the side of integrated. I hope that answers that question, but happy to share some of the research too, if that's helpful.
Thank you, Sam. Our next question is from Anuradha. have mentee perceptions on this integrated approach been explored? I'm wondering if a mentee would hesitate to connect, talk about personal stuff with a mentor who discusses that information with teachers, a school counselor about that student.
Yeah, great question. So this is really delicate, and this is something that we've developed tools around. I'd love to hear Carrie's reaction to this too.
Yeah.
But in my experience, you have to be really delicate. So just to give an example, in our program, we had a mentor last semester who the program and the school knew that this student was having some trouble with anxiety and things around that. We didn't share that data with the mentor, but we shared some practices that could help make the student be more brave and confident in school. But what we found from supervising the mentor is that the mentee was just in general pretty shy and didn't want to share a lot last semester. But then fast forward to this semester, after that relationship has really blossomed, the mentee's sharing everything with their mentor and is really receptive to these type of practices. So part of that importance of supervision is that you're not rushing into intervention or instrumental support, but that you're really giving that youth voice. And then one of the other tools that I'll mention, then I want to pass it to Carrie for this question, is we're in the process right now developing a youth family teacher voice and choice interview, which is basically something that a program coordinator or even a mentor could use, where they talk to the young person around their perceptions of what they'd like to work on, their goals. They talk to the child's parent around the same thing, but then they also check in with a school personnel like a teacher. And they approach a conversation with the young person in a very child-centered way of how would we like to spend our time together? How would we like to make decisions around this? And when you put that young person in the driver's seat and give them kind of the autonomy to make those choices, as we've seen just from that vignette I gave, oftentimes youth will nominate themselves for participation in some of these prevention or intervention focused activities. Carrie, why don't you take that one too?
Yeah, that's a good question, because this is, we really approach this from, and I said earlier about building relationships and being there, 5 days a week, and all day. We really get an opportunity to do that. And something you just hit on, Sam, is we try our hardest to show kids how to advocate for themselves, especially as it pertains to their academics. And we become that trusting voice. We've told every kid, because we also do, outside of the group sessions, we do one-on-one sessions with each one of our kids on a weekly basis, or at least bi-weekly at the longest. So we come in, we sit down, we go over their grades, we go over attendance, as long as everything is in order. If they have behavior issues, hey, what's going on? You want to talk about it? And then we also give them the floor to kind of express how they're feeling, some things they might be going through. At first, mum's the word, by the third or fourth time we're talking, as Sam said, they're telling us everything. Because they don't have anybody to talk to, or they don't feel they have anybody to talk to. And everything they say to us is in confidence. We're very clear with all of our students. You can share anything you want with us in confidence, unless we feel that we find it as a danger to yourself or a danger to someone else. At that point, we would probably get the counselors involved and things of that nature. And so that's kind of how we operate. And that's been it's been very productive for us. We're teaching kids, let me give you just a quick example. I had a kid not long ago. He comes in, I got an E in a class, and I'm going to be ineligible for basketball. Okay, well, did you find out what's going on? I said, well, my teacher doesn't like me. What do you mean she doesn't like me? She just doesn't like me, and I turn my stuff in, and she never grades it. And so I tell students, I say, hey, you need to go to your teacher and say, hey, I'm really concerned about my grade. What is it I can do to improve my grade? And so he'll go and do that. I make a phone call to the teacher on the back end, say, hey, Jordan's coming to see you. He's very concerned about his grade. He thinks he thinks you don't like him. And she's like, oh no, he's great. He just doesn't follow through. And he just, whatever the case is. And I'm like, well, he's coming to see you. So just, if he has an attitude, I need you to look past that for a minute and hear him out. So the student goes there, finds out he has assignments that he just hadn't completed properly or something. He does all these assignments in 2 days, comes back to me, hey, Mr. Smith, I got a B- now. She gave me credit for my classes. And I say all that to say is we're teaching our kids how to advocate for themselves. More importantly, we're also a liaison between them and teachers, because there's a big gap between teachers and also students. There's cultural differences. There's all kinds of things in between there. So we're also in a position to help our teachers. We're training teachers how the best way to respond to this group of kids, to these kids, and it's paying big benefits because now they're talking. We have dialogue. They have dialogue. And teachers are coming to us when they have an issue with the kid now, saying, "Hey, we got Timmy in our class. Can you talk to him?" And we'll go do that. But again, we still hold all that in confidence unless we find it's something that we really have to report out on. So I hope that helped a little bit.
Thank you, Carrie. We're going to keep you on the mic, Carrie. There's a couple questions for you that I'm going to jump to.
Okay.
So we've got 2 questions from Iona, so I'm just going to send them to you at the same time. So she says, Carrie, I'm curious, is your program building capacity for schools' ability to engage in one-to-one mentoring beyond the capacity of the counselors? Are y'all offering services that counselors do not provide? And then Iona's second question is, what does the training for your in-school mentors look like in terms of how to approach and build relationships with kids well? And you're kind of speaking to that a little bit. We are looking to bring more of that for our programs in school site coordinators.
Okay. What was the first question again? I'm sorry.
No, that's okay. I didn't do you any favors with that. Is your program building capacity for schools' ability to engage in one-to-one mentoring?
Gotcha. Okay. Gotcha. Now, so good question. So here's what we do. So we bring in, I mentioned our group sessions, right? So we'll do our group sessions. We'll have 8 to 12 kids in that, and we do male and female cohort. So those are separated. So we'll do our group session on a Tuesday or whatever the case may be, and we'll bring in our volunteers and other mentors. They'll actually come into the sessions and sit there with us. So you'll have 8, 12 kids, and you'll have maybe 4 or 5 mentors. And as we're going through our group session, those mentors may be chiming in on whatever activity or whatever discussion we're having, and they're doing that weekly. So what's actually happening is our students are getting to know these adults that we have already screened, and they've already been screened not only through United Mentoring Program, but they've also been screened through the school district. So from that aspect, we're good to go. But they're having an opportunity to build relationship with these kids and the kids with the mentors. And most of the time, what happens, these one-on-one opportunities actually become very organic, and they turn into these one-on-one relationships. But what's hard is the old database way of, I got a kid who likes basketball and bowling, and I have a mentor that likes basketball and bowling, and boom, maybe they'll be good together. No, that's just, this doesn't work. But we really tried that organic approach to it, and it's been very successful. And and another thing is, some kids don't want a mentor, and that's fine. And we've had kids tell us that. And if that's not the case, then the program will still continue to serve to be the mentor. What was the part 2 of that question? I'm sorry.
No worries, Carrie. So the second question is, what does the training for your in-school mentors look like in terms of how to approach and build relationships with kids well? We are looking to bring more of that for our programs in school site coordinators. Yep,
we'll use Coursera. They have some mentor training available within their platform. And then we are actually we actually have one of our mentors, one of our staff members does video and all that stuff. So we're actually looking forward to creating some of our own training material and just creating some of those scenarios. And I tell you this, everyone that we have on staff with us, they've been a volunteer first. And that's just kind of our requirement. So we know who we're bringing in. They clearly understand our objective, what we're doing, where we're going, how we operate, and then any training that's going to come with that before they start working for us.
Thanks, Carrie. We'll move on to a question from Jim. One of the school districts where we serve is a large 185,000 and very bureaucratic. Teachers, counselors, social workers, and coaches are great to work with, but are very restricted from data sharing. So insight is anecdotal at best. How can we overcome that obstacle?
Yeah, so that's a great question.
Yeah.
And I think, Jim, you asked that. My suspicion is you might be in Texas or something. I was in Houston and we had those giant school districts too, 200,000 kids and whatnot. So here's what I've learned. So we're working in South Carolina. We don't have a district that big. We're working with a district that's about 70,000 students, biggest district in Carolina. There's absolutely no substitute for engaging leadership at the top.
That's right.
And
Yeah.
we've tried it, and maybe some people have been successful the other way, but you really need to have, and a lot of times that entree to the top comes from the building level folks. But if you can get in with, like, a big school district like that, there's going to be levels of bureaucracy to move through. But if you can get in with the folks that are responsible for community partnerships and then MTSS coordination, and provide a compelling case why something like this is worthwhile, talk about the scale of it and those type of things. And then have a couple demonstration schools, say we'd like to have a demonstration project with a handful of schools to do this. That's what we found to be successful when we engaged the school district leadership. We've done this in South Carolina, Low Country, Midlands, Upstate. But when you get that leadership up top at the district level on board, the doors open up years faster than trying to do it from the bottom up. And I've done it both ways before. And I think that the way that we recommend it right now is that you establish those partnerships vertically, from the program to the top, but also horizontally while working with schools. And this is why, and I'm sure Carrie can talk about this too, but the reality is that these type of integrated partnerships, they don't happen overnight. And that's why that's our motivation to create a certificate program. Is it can work wonders to have resources that tell both participants what's the value, what's the value proposition of this partnership, but then what's our mutual responsibility to each other. And just to give an example, I talked with a person that's in a school district just yesterday, and they said, the school district has mentoring as a core priority. But the mentors go into the school, they don't talk to anyone. There's no kind of partnership or anything. And what we've talked about is, okay, well, let's get together with kind of the mentoring programs in the school district and talk around what best practice would look like and talk around some of our success that we've had. So I think, Jim, that's an important question. It's a challenging one. And I think ultimately it's going to come down to healthy team-based relationships between these organizations where you've got common shared values and goals, and you're meeting with each other regularly to solve some of those bureaucratic challenges. But I think if we can do it in, South Carolina and Texas, I imagine other folks can do it too. In Michigan, to Gary. So.
Yeah, Jim, you got to go to the top. And that's where we started. We started with the superintendent of the school district. And he actually hired a graduation specialist / community partner, the coordinator. So we, and it's one of their priorities is mentoring. And so that's what got us in the door. And then we started out, we did a pilot program with one school in the spring, and that was phenomenal. And then we started out with one school, and we did our job. We reported out. We did everything that we said we were going to do. And then that in turn, and we had to build the relationship with not only students, but with teachers. I mean, we sit in on IEPs. We sit in on EWIMS meetings, which is the early warning intervention and monitoring system. So we're embedded in what our schools are doing. And I think, and yes, you may have some people who are a little guarded, but you got to be very clear with your vision and what you're coming to do. And our biggest thing is we tell all our schools and principals, we're there to support you. We're not there to do our own thing. We're not there to create a new wheel. We're here to support you. Let us know what that support looks like, because we cater to every school. Every school is not the same. So I would think that would be, to me, that's the best route to go, is go to the top so that everybody's speaking the same language. We go to staff meetings. We're at staff meetings beginning of the year. If we got a new school, we go to that staff meeting. We clearly explain our objectives, what we're here to do, what we're here not to do. And so that plays a big part in that.
Thanks, Sam and Carrie. Next question from Tiffany. What type of data should one be looking to collect to report to the schools? I heard attendance rate, academic achievements mentioned. Any others that you all feel like is a good one to track?
Yeah, so that's a great question. I think this again highlights the importance of teaming and shared decision making around this. The school districts are going to have a lot more data on collective youth functioning than the program will. You know, if you're looking at the big picture of what's going on with the school, what are the top needs, a lot of that data is going to come from them. What we've found to be the most effective for a mentoring program entering a school district is to talk to the school district around what are their priority outcomes. And a lot of times, to Carrie's point, attendance is a big one, especially coming out of the pandemic, peri-pandemic, getting kids in the school is big, probably followed by misconduct in the classroom, and then, you know, the other SEBA outcomes, social, emotional, behavioral. Excuse me. One of the things we found helpful is to have kind of a shared vision and values meeting around what do we want this partnership to look like and what are we concerned about with our data. For an example, one of our partner schools, their universal screening data is flagging around 30% of the students for having clinically elevated levels of anxiety. That's a priority because the school districts, the administrators know that when kids are anxious, their test scores are, you know, about 4 to half of a standard deviation lower than if they're feeling relaxed before they go do it. So they're concerned about school-related anxiety, and they know when standardized testing season comes up, that's going to be something. We say, hey, you know what? We've got some trainings we can give to our mentors around these outcomes, and we'd love to track them for the kids that are being mentored as well. But ultimately, like anything, the schools in Lancet, Michigan are going to be very different than the schools in Columbia, South Carolina, or Greenville, South Carolina. They're going to have different outcomes, different needs, and we're also going to have different resources, different trainings, different, you know, lived experiences of the mentors that are going to be able to help support with. So I think it's best to have those type of conversations collaboratively between people, rather than, you know, the mentoring program coming in saying, we're a mentoring program and we do this, or we're a school and we only want you to do this. You know, it's not really teaming if we're not sharing decision making.
I agree. For us, you know, we really tapped into what the Lansing School District, what their objectives were. Their objectives were increase the graduation rate, increase attendance, and then obviously lower some of the behavior incidents they've been having throughout some of the schools. And as I mentioned, our graduation rate in the district, you know, went up by 25%. So that's what we report out on. We report on the ABCs, academics, behavior, and coursework. And to do that, you know, we have access to every student at schools that we're in. We have access to their grades, their attendance, and their behavior, real-time data. Like, you didn't turn in something yesterday, I can see it that you didn't turn that in. So that's what helps us stay on top of our kids and helps us to report on where they're at. So we get we come in beginning of the year, they're, you know, first semester, first marking period, they have a D in science. So we're monitoring that D, we're monitoring what they're doing. And we have a grading scale, which we put on all of our students. So we can identify if they're trending the right way or not. And that was what we report out. We report out every month. Here are our students that are assigned to us. Here's what they're doing. Here's what they're not doing. Attendance is a big part of what they're doing and what they're not doing. So we're involved in every aspect of those three items. That is what we're reporting out on every week. And then if we do anything special during that month, we also report on that as well.
Thanks, Carrie and Sam. And our last 4 minutes, we'll see if we can squeeze in 1 or 2 last questions. Another question from Iona. Sam, curious, what is the #1 non-evidence-based practice you see mentors and programs doing?
I think probably the biggest one that we've done some training on, and happy to share some of this, is something that in the motivational interviewing literature is called the fixing reflex, or when mentors or programs go in with this, goal or ethos of we're here to fix a young person's problems. Like we're going to come in and we're going to, they're out of control. We're going to go fix it. And there's a lot of behaviors that spill over from that vantage point. Behaviors like arguing with young people, telling them war stories about how hard it was when you were growing up, belittling them, get your act together. This type of behavior that really is more, it feels like antagonism rather than partnership. And I think a lot of our motivational interviewing training videos, as you'll notice in that one that we shared, they're really focused on don't do that. Don't run in and try and fix the kid. Don't come in with a mindset of this kid is a problem that needs to be solved, or that they've got, having that deficit mindset is really toxic. And kids will talk with their feet. They just won't come back. They'll say, I don't want to be around that person. They yell at me or they fuss at me or whatever. But I think Carrie mentioned this before, is like a lot of the training that we do are designed to minimize relationship disrupting events. If you can minimize the likelihood that you're going to disrupt that relationship, what you're going to see is kids are going to be more open to feedback. They're going to be more open to solving kind of, what do I need to be focused on right now? What would be helpful for me right now? How can my mentor help me get there? I just am thinking back from that early trial that I mentioned. Well, we would, tell our mentors, don't argue with your kids, don't fuss at your kids, don't do these things. Then we went and watched them, and they were arguing with the kids, fussing with the kids, and the program didn't work. But when we altered those mentor behaviors to be more youth-centered and compassionate, and more focused around the youth perspectives and needs and their values and what they want to work on, all that other stuff fell into place. So I just think that these mentors aren't bad. It's just we all have that, especially the helping type of person. Like we see something and we're like, oh no, we got to help this kid out. He doesn't know what's coming for him. But a lot of times those helping behaviors can backfire.
Well, I think that is a perfect note to end on. Thank you so much to Sam and Carrie for joining us today, and thank you all in attendance for your excellent questions. I see that there was one question we weren't able to get to in our Q&A, so we'll refer that to Sam to send any other just-in-time training videos that we can send in our follow-up email. So after our webinar today, you all will get a follow-up email that will include the slides that you saw today. It'll also include all those links and the QR code that Sam shared, where you can watch those videos and reach out to Sam's team if you are interested in partnership. You'll also get a very, very brief eval just to share your feedback with us on how this webinar went. Again, thank you all so much for joining us today, and to Carrie and Sam for sharing with us. And we hope to see you all at a future NMRC webinar. Thank you so much.
Thank you.